Dr. Sherry here, and today we're going to be going over the CNA's testable skill, foot care. So the supplies that you will need for this skill will be 1 towel, 3 washcloths, a water basin, soap, and lotion. All right, so we're going to introduce ourselves to our patient and explain the procedure. So I'm going to wash my hands, knock on the door. Hi, my name is Sherry. I'll be your CNA today. Can you tell me your name? Okay, Robert. I'm going to do foot care today. Would that be all right with you? All right, wonderful. I'm going to grab my supplies and I'll be right back. I'm going to check the bed and make sure it's locked. He does have his call light, and I'm going to come and get my supplies. So I have my supplies ready, but I'm going to go ahead and get my water. And the water should be at 105. It shouldn't be any hotter than that. Most places have a thermometer you can check, but for the skill evaluation, you don't need to. All right, the next thing we're going to do is make sure that our patient feels that this water is at a good, comfortable temperature. All right, Robert, would you like to touch the water and make sure that it feels comfortable for you? Okay, great. All right, we're going to go ahead and get started. So I'm going to go ahead and apply my gloves. Going to provide privacy. I'm only exposing the area that I'm working on, and I'm going to lay my towel down so we don't get his bed all wet, and supporting his leg while I do that. All right, then I'm going to take the water and I'm going to place my patient's foot in it. All right, Robert, we're going to put your foot in the water. All right, and then I'm going to take my first towel. I'm going to apply some soap. Get it nice and wet. I'm going to lather the soap up in the washcloth to make sure that it's got enough soap on it. I'm going to raise my patient's foot out of the water, and I'm going to clean his foot. I'm going to do each nail and then in between each toe. Okay, then I'm going to get the top of the foot and make sure I get the heel. I'm going to go ahead and put my dirty in this corner. So I'm going to take another washcloth and place it in water, and this time I'm going to rinse. So I'm going to start here on the top. I'm going to go over and do each nail and in between each toe. The bottom, and then the heel. I'm going to put my water basin down. I'm going to take my dry towel and just dry the area. And then I want to make sure that I dry in between each toe. All right, Robert, all done washing. I'm going to go ahead and apply some lotion to your foot. Would that be okay? All right, so then I'm going to grab my lotion and I'm going to apply it to my hand. I always do this to make sure that it's kind of warm. And then I'm going to apply lotion on his entire foot except his toes, okay? Because we do not want lotion in between the toes. When you get like wetness in between the toes, like that's where yeast and other types of things can grow, and then sores can get there. So especially with diabetics, so we want to make sure that all of it is dried. So then I'm going to take my towel and I'm just going to pat dry any excess lotion off. Alrighty. I'm going to go ahead and take my dirty linen and place it in the basin. I'm going to, or the dirty linen area. I'm going to cover him back up. I'm going to take my supplies and put them back. And another step is to empty the water, rinse it, and then you need to dry the basin. And then you're going to put it in the dirty area, wherever that's designated at your skills evaluation. I'm going to put this in the dirty linen basket, and I'm going to remove my gloves by pinching my palm placing it in this hand and putting my fingers underneath this glove, taking them off, and then I'm going to put them in the trash. I'm going to wash my hands, and I'm going to go back and finish up with my patient. All right, Robert, is there anything else I can get for you? All right, here's your call light. Just go ahead and press it if you need anything. I'm going to check his bed, make sure that it's good, and I'm going to remove the privacy, wash my hands,